Hello, everyone. Wow, today is the first day of September. Today is Wednesday, September 1st. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. We're here at our downtown Keeler location to give you our daily update on the impact of the COVID-19 pandemic on Mobile County. Let's see, 498 COVID-19 cases were reported yesterday. That brings our cumulative case count to 64,208. If you remember, we've been counting since March 19th of 2020. So that was the day that the first Mobile County resident was reported as having COVID. And now we're over 24,000 cases. We learned of 3 additional deaths yesterday, bringing the number to 1,037. And as we talked yesterday, the number of deaths will continue to rise for another few weeks, I think. The total number of hospitalized with COVID is at 7,937. 50 additional hospitalized patients were diagnosed with COVID yesterday and reported by our local hospitals. Again, the numbers of cases appear to be going down slightly. That's good news. We've had slight reductions each week for the last 2 weeks. And today, for the first time since August 7th, we have less than 400 people in mobile hospitals. The number in the hospital yesterday was 383. So that has continued to decline for a couple of weeks or for a couple of days now. And I'm so glad to see it under 400. I would like to see it back down in the double digits as quickly as possible. But of course, that's going to take all of you to do what you need to do to slow transmission to keep people out of the hospital. Again, the overwhelming majority, 85% or so of those 400 or 383 hospitalized people are unvaccinated. They are younger than they were before because, again, our older populations are vaccinated. So what we're seeing now are cases and deaths in younger people. The deaths that we do see in older individuals that are vaccinated are people who have immunosuppressive conditions or have other underlying health conditions that predispose them to severe illness. So again, nice to see the numbers going down, nice to see the hospitalizations going down, and we'll continue to keep a close eye on the number of deaths because I expect it will continue to be high for at least another 10 to 14 days. All right, a couple of questions here that we'll deal with. Asking about our hospitals seeing some relief. So across the state, we are still have more people being treated with intensive care than we have ICU beds. So that is still a problem across the state, including Mobile. Yes, a reduction in the number of hospitalized patients is greatly helpful, but it will continue to be a difficult situation for our hospitals until we see numbers drop down in the low double digits. Because in addition to having a large number of COVID patients in the hospital, hospitals are also having staffing issues with staff that have, exposures or have children with COVID or with exposures that aren't able to come to work. So I think that our hospitals will continue to feel stress, certainly additional stress now because of some, people have evacuated to this area from hard-hit places from Ida. So that's going to put some additional stress on our hospitals. And until we can get the number of COVID patients down to low double digits, it will continue to be a difficult situation for our hospitals. But we are so grateful that they're there for us. All right, the next question was about Louisiana residents being displaced because of the hurricane. I just referred to that, and Labor Day. How do I see the numbers shaping up? So I think we generally see a little bit of a dip in the numbers over the weekend. So the fact that the hurricane came on the weekend and we had closures due to the hurricane, and then, I think we'll see a slight dip in the numbers, but it will quickly rise back up. I think we're going to see more transmission around football games, Labor Day, holidays, that sort of thing, probably then we will see from, instead of seeing transmission related to Ida. Yes, people had more folks in their home. I had 5 more people staying with me over the weekend that were displaced from South Mississippi, but I don't think that Ida is going to be a super spreader event for Mobile. I think what we're going to see is a slight dip, and I think after Labor Day, a week or 2 weeks after Labor Day, we will start to see an increase due to holidays, the holiday, and schools and extracurricular activities. Someone asking me about, do I know any medical professionals that are not encouraging vaccines? No, I don't know a single medical professional that does not support getting a vaccine, or that are actively discouraging vaccine, I should say. They may have a personal decision not to get a vaccine, but I don't know of any medical professionals that are discouraging vaccines. And I don't know of any that are encouraging animal drugs for use in humans. I don't understand that question, so I'm going to skip it. So some Facebook questions. When will we reach herd immunity? Not anytime soon. Remember, herd immunity is 70 to 80% considering the Delta variant. We are around 35% of people who are fully vaccinated. So we will not get to herd immunity. Maybe never. I would like to think that we still have enough people that we can discuss vaccine hesitancy with, that we can compel folks to get vaccinated, but I would never have predicted that we would be 8 months in to 2021 having a perfectly safe and effective vaccine and only have a minority of the county elect to get that free, safe, and effective vaccine. There's a question about how long do you have to wait to get a third dose. So if you qualify, if you're eligible for a third dose, then you should wait 28 days before taking a third dose. And remember that third doses are authorized, or FDA authorized, for people who are moderately or severely immunocompromised. And if you fit that description, you'll be asked now to sign an attestation letter saying that you attest to fitting one of the 6 categories that describes moderately or severely immunocompromised, so that we will have your signature and attestation on record. And you should wait 28 days after your second dose of Moderna or Pfizer to get a third dose. Someone asking about a side effect of the vaccine. We talked about this yesterday, that there is a small link between vaccination and myocarditis in young men, but this risk is not greater than the risk of myocarditis from getting COVID. So in a CDC study that was released earlier this week, people who were unvaccinated and got COVID were 16 times more likely to experience myocarditis than people that did not get COVID. So again, the small risk of myocarditis from getting vaccine does not outweigh the benefit of getting vaccinated. If that changes, we'll let you know. I'll be the first to say. But right now, we know that there is an acute link. Usually young men, their symptoms will resolve after a month or so, and CDC is studying to see if there is a longer effect, 3-6 months out, to see what's happening there. Someone asking about figure 4 in the weekly letter, that the number of cases in 5 to 7-year-olds went up while others went down. Do I think this is from schools? Yes, this is definitely transmission in school-age kids. Now, it's sometimes hard to determine whether they got exposed at school or if they got exposed at football practice or at volleyball practice or at band practice or at a birthday party or at the climbing gym or at the trampoline park. So it's very difficult because we have such high transmission going on. It's sometimes not easy to determine if a school-aged child got COVID at school or at some other activity in the community. I don't know when a vaccine is going to be ready for people who are 0 to 11 years old. I had heard, this was some time ago, early summer, that it might be fourth quarter 2021 or first quarter 2022. We're already bumping up on the last quarter of the year, surprisingly. So my guess is it's going to be early 2022. Someone asking, does a doctor have to prescribe? They say they're calling this the infusion. I'm assuming they're talking about a monoclonal antibody injection. Monoclonal antibodies can be given either they can be given intravenously or can be administered through a subcutaneous injection. So monoclonal antibodies, yes, must be prescribed by a doctor. A question, can you go to other outlets to get a third vaccine? I assume, we're definitely giving third doses to people who are eligible, and I assume that other vaccine providers are doing the same thing. Someone asking about when are booster shots going to be approved. We are being told that maybe mid to late September we may receive more guidance from FDA or CDC about a booster dose. Someone asking if there is a percentage of students that would make a school close, and the answer to that is no. There are no sort of hard marks. There are no, metrics that say, okay, if you have 17.5% of your kids out, you have to close. And again, the health department doesn't tell anybody that they have to close. Basically, you continue to operate until you don't have enough staff or enough bus drivers or enough cafeteria workers to safely open schools, or you have so many children that are out sick that, there's no reason to continue on. You want to stop, send everyone home for a virtual option for 14 days to try to slow the outbreak or stop it in its tracks before bringing people back to school. Any cases of Lambda variant reported in Mobile County? Yes, we have seen a handful, but interestingly, the Delta variant is so highly infectious that Lambda and any of the other variants are not able to take a foothold here. Delta is 95% of all the COVID that we're seeing in Mobile County and in Alabama and in the U.S. So someone asking if you get sick after the vaccine. So either of the vaccines, all three of them, have mild reactions associated with them. So you'll have, your arm will be sore, you may feel a little feverish, you may have a little bit of fatigue, you may just not feel well for 24 to 48 hours after the injection. But those symptoms will resolve within a day or two of getting vaccinated. And again, these are normal side effects of a vaccine. Very few severe adverse events have been recorded with the Pfizer or Moderna or J&J vaccine. All right, here's a question.
Can you get a flu shot and COVID booster at the same time?
Yes, so the question is, can you get a COVID shot in combination with another injection? And the answer is yes. So if you're getting your flu shot or your shingles shot, or if your kids are getting their childhood vaccines and they're 12 or older, go ahead and get them vaccinated for COVID at the same time. Anything else?
One about encouraging the governor to have schools closed again, but that we don't have jurisdiction over schools.
Yeah, if someone's trying to encourage the health department on Facebook or the state health department to try to close schools, that's not what we do. We advise and we collaborate and we try to inform and educate, and help them make the best decisions that they can. But it is the local education authority that makes decisions about school closures. So with that, we will end. And again, we will not have a Facebook Live update tomorrow or Friday or Monday. And we will be back with you. I think that means on September 7th, on Tuesday following Labor Day. So stay safe, everyone. Remember, get vaccinated if you're eligible. And if you're not eligible, then you must wear a mask and distance yourself when you're out of your house. And even if you are vaccinated, it's a best practice to go ahead and wear a mask and distance when you're around people that you don't know or for whom you don't know their vaccination status. That's the only way we're going to be able to continue working towards slowing our outbreak. So have a safe and restful Labor Day weekend, and we'll talk to you next week.